Hello, and welcome to our first stop on the road to care transformation. This will be a look at our telehealth program.
Our patients are increasingly time-crunched and technologically savvy, so it comes as no surprise that they prioritize access over in-person visits by as much as 76%. It's this growing demand that makes our telehealth program a critical component of our care delivery system.
UW Medicine has been using emerging telehealth technology to improve patient health outcomes and advance provider education, particularly for those in more remote Pacific Northwest locations. In the last 12 months, UW Medicine saw 15,000 telehealth patients, including in virtual clinics, provider-to-provider through e-consults, and provider-to-patient via teleconsults. The telehealth dyad of Dr. John Scott and Director Carrie Priebe is leading the charge and evolving the program for today's patient and payer needs.
I was hired in 2013 to be the first medical director for telehealth and to blaze a path of sustainability. So part of my work has been working with legislators and policymakers to help telemedicine get reimbursed, and we've achieved a lot of those goals. For patients, this is a real benefit to them because it's way more convenient, and we're really refining a lot of the processes that are involved and have a very well-established training program. It allows us to keep closer eye on our patients, especially maybe patients who are transitioning from inpatient to outpatient. We also have our teleburn program, which is for patients who are coming from the Pacific North region or WAMI region and have a complex burn condition. They are often seen by our doctors, maybe be inpatient, and they have the option to have their follow-up visit care by telemedicine. So they don't have to drive all the way in from, say, Spokane. They can see not just the burn surgeon, but also occupational therapists and a clinical psychologist, just as if they were being seen here in our clinic at Harborview. And the patients have really liked that.
Sean Free is one of those patients who benefited through care at UW Medicine and follow-up through the teleconsult program.
I was working on a propane truck, a delivery truck, and I was going to rebuild the pump on it, so I had to evacuate the system. As I was evacuating the system, the truck started purging all the liquid out, so I climbed underneath it to unhook the main valve, and as I did that, something ignited all the gas, and it blew up, and I had to run from the fire and jump in a snowbank, put myself out. Then passerbys took me to the side of the road, and I talked to the sheriff and the ambulance and went to the Helena Hospital, and then was life flighted to UW Medicine.
The patient was injured several months ago and had a long hospitalization. He was here for about 2 months, and only recently we discharged him home. I'm eager to find out what he's been able to do at home in that time. We find that the issues that are really important for patients are to wean off from their pain medications, to deal with the itch and having solutions for that, to reinforce the importance of stretches, and to be participating in active physiotherapy, and to return to work. Any problems with any one of your joints?
Only like bending down my back. Anything that stretches my back, bend it down, touch my toes. That's really the only range of motion problems I have.
Right. We see about 100 patients a year through video conferencing, and we have many more patients than that who send us pictures through e-care. Operationally, this is a program that's for our established patients, where we sign them up to 2 apps upon their departure from our discharge, either inpatient or in the clinic, and we ask them to download the Epic app, and we ask them to download the Zoom app. Our patient care coordinator or our nurses will help them with that, so we make sure that at least on one of their devices that is available.
Well, it's a huge time saver and money saver. I live in Boise, Idaho. I don't have to travel all the way to Seattle. Driving takes about 8 to 9 hours one way, and then, flying's expensive.
I think that this service needed to happen in a regional care system. Now we see this as an option. If you come as a patient and you say, I prefer coming in person, we say, fine, that is what you want. Or if you want just a picture of the video conferencing, that's what you want. And we find that to be a maturation of the system. We don't try to push it for only one way or the other. We truly see this as a choice.
I think it all goes back to the mission of UW Medicine, which is to improve the health of the public. And I feel like telemedicine is just a really powerful tool for us to achieve that goal.
Well stated, John.
And with goals this year to expand teleconsults to new partners and specialties, including psychiatry, stroke, diabetes, and post-discharge, we'll be making a big difference in our patients' lives.